For our major assignment, we chose to talk about the healthcare system, specifically in the emergency room in Canada. Why is the healthcare system in the emergency room in Canada bad? Canada's emergency rooms are in a crisis. An article by Adam Miller and Prapti Bamania on CBC News, posted on June 24, 2023, claims they're short-staffed, overworked, and patients are waiting too long for care. Recently, a hospital narrowly avoided disasters when multiple critically ill patients arrived at once. Doctors and nurses are speaking out and saying it's worse now than during COVID-19. Some patients have tragically died waiting for care. Medical workers are fed up and calling for urgent reforms, but the problem goes beyond just ERs. There aren't enough family doctors and long-term care is lacking. The system needs a major overhaul and it's at risk of collapsing entirely.
My name is Tanner and this is my first slide. What are the arguments in this topic? The arguments for the topic of healthcare emergency rooms can be listed below. The weakness of the emergency rooms, specific problems and reasons why the emergency rooms are bad, the pros and cons of the emergency room, comparing them to other countries and how Canada stands up to their healthcare systems and their emergency rooms, and how it can be improved upon and different political parties' views and ideas of the emergency room.
Okay, so talking about all the cons about the Canadian healthcare system and the emergency room, what are the pros? Although we talk about how bad Canadian healthcare systems is in the emergency room, there are pros and cons to it. According to the author Kate Piemonte, to the article of Pros and Cons of Healthcare in Canada, a closer look, Piemonte stated that there are good sides of the two Canadian healthcare systems, even with its downs. First, it gives access to universal healthcare coverage. With a health card, Canadians have the opportunity to access many different types of treatment in Canada. It reduces additional expenses, so it gives everyone access to medical care without worrying about money. This helps poor people and sick people a lot. Addresses social inequity. The Canadian healthcare system makes sure that everyone gets treated fairly no matter how much money they have.
My second slide, I'm going to briefly acknowledge the weaknesses from my own position and I'm going to address them. The issues from my position that I think need to be addressed on the healthcare system would be the wait times and the lack of staff. The wait times are a big problem because people having to wait extended periods of time to get an issue checked is not fair and harsh to the patients. Anyone needing medical care and needing a doctor's attention as soon as possible is having to wait, and that can be pretty crushing to them and their families. The shortage of staff affects everyone because with not enough staff, the wait times become longer and patients cannot be checked as soon as they need. Doctors and nurses are very important to everyone in our society, and we definitely need more of them. The future of Canada's emergency room in healthcare. The future of Canada's emergency room is still in crisis for the foreseeable future, as the wait times, the shortage of staff, and the constant increase in patients are still continuing to be a problem and does not seem to have a decrease anytime soon. Recent years have seen the worst of it due to COVID-19, as the patients' increase has becoming too much for hospitals to handle. Along with staffing issues and the vaccines needed, it definitely made the issue bigger than it already was, as the issue was already present, and with having COVID, it just added on to that and it still has not been fixed since.
Comparing Canada's emergency room healthcare system to other countries involves looking at various factors such as access, quality of care, and patient outcomes. Here's a comparison with a few countries similar to Canada. United States. The U.S. healthcare system is largely privatized, with emergency care often provided by hospitals and clinics that may be either publicly or privately owned. One of the significant differences is the presence of large uninsured population in the U.S., leading to some individuals using emergency rooms as their primary source of healthcare. This can result in longer wait times. Additionally, costs for emergency care in the U.S. can be substantially higher than Canada due to lack of universal health coverage. United Kingdom. The UK's National Health Service provides universal health care coverage, including emergency services. While wait times in UK emergency departments can vary, the UK also has a system of primary care services that serves as a first point of contact for non-emergency healthcare needs, helping to alleviate pressure on the emergency departments. Germany. Germany has a multi-payer healthcare system with statutory health insurance covering the majority of the population. Emergency care is provided through a network of hospitals, including both public and private facilities. Wait times in Germany, emergency departments tend to be shorter compared to some other countries, and patients are generally based on medical needs. In comparison to these countries, Canada's emergency room healthcare system generally provides a universal access to emergency care, with wait times varying depending on factors such as severity of cases, hospital resources, and regional healthcare policies. Additionally, concerns have been raised about overcrowding in emergency departments and the need for improved coordination between emergency and primary care services. Some ways we can improve Canada's healthcare system in the emergency room is improving efficiency, implementing strategies to reduce wait times and overcrowding in emergency departments, such as better systems to reduce less serious emergencies, increased staffing, and improved coordination with primary care providers. Another way to improving the health system in Canada is expanding access to emergency care in underserved cities through the development of new facilities or maybe mobile units, or making more hospitals in high populated areas. For example, Brampton only having one hospital, having two opens up more jobs and as well as easier access to more healthcare emergency rooms. Cut costs of medical students. Cutting costs of medical school is a smart and efficient way of incentivizing more people to become doctors and allowing the healthcare system to expand and grow in less developed cities. In Canada, different political parties and their respective teams may have varying views on the emergency room healthcare systems and strategies to improve it. The Liberal Party of Canada often emphasizes the importance of universal access to healthcare, as they spend a lot of money on it, including emergency services. Their approach may involve increasing funding for healthcare infrastructure and promoting innovation in healthcare delivery through technology and research. Conservative Party. The Conservative Party typically advocates for greater efficiency and cost-effective in healthcare delivery. Besides pointing out the private delivery of services already exists in the country, Pierre Poilievre, his priorities for the healthcare includes shortening wait times and getting provinces to more quickly approve the foreign credentials of immigrants to deal with staffing shortages. The New Democratic Party prioritizes the expansion of public healthcare services and reducing wait times. Federal New Democratic Party leader Jagmeet Singh says the federal government needs to utilize the Healthcare Act, which he has said has significant powers to challenge for profit privatized care. The reason I did not mention other parties like Bloc Québécois, Green Party, and People's Party of Canada is because their views pretty much align with their parent parties.
Okay, so in conclusion, to summarize everything that's been said so far, the emergency rooms and the healthcare system, Canadians overall feel like it's progressively getting worse over the years, from the waiting times to the poor healthcare treatments in the long run. People every day are dying in the emergency rooms because people aren't being treated on time. Furthermore, the Canadian healthcare system is doing poorly compared to similar countries like in the UK and Germany. However, there are many ways to improve it, like improving efficiency and cutting the cost of the medical school and allowing easier access. Adding on, the many political parties in Canada have varying views and solutions on how to improve the healthcare system in the emergency room. Okay, so that is the end of our amazing presentation. Here is our bibliography. I hope you enjoyed the video, and we hope you have a great rest of the summer, sir.